Hello viewers, with the amendment of COVID-19 regulations by different governments all over the world, it's clear that we are coming out of this COVID era. I am Dr. Rajneesh Kumar, consultant physician and clinical diabetologist at Total Health Limited, Cayman Islands, and I am here to discuss a very important topic with the name of post-COVID syndrome. So, what this post-COVID syndrome means? This post-COVID syndrome is basically it's a condition which are basically has got a lot of range of different symptoms, which are basically coming in and ongoing health problems. People can experience 4 or more weeks after first being infected with the COVID virus as such. Even people who did not have COVID symptoms, or also called as asymptomatic COVID infections, they may also suffer with this syndrome. Before starting with the post-COVID syndrome, I would like to give a brief introduction of the course of COVID infection itself. So, clinically, we divide the COVID infection into two groups of diseases. First, related with mild to moderate symptoms, and second, with the severe symptoms. In first group of COVID infections, after exposure, we expect the patient to get fully improved or become symptomless within 2 weeks of the presentation. While in severe cases, this 2 weeks is further prolonged, may go up to 6 weeks, but the recovery is there in even severe cases of COVID infections, or they get complicated. So, most people with COVID-19 experience generally mild to moderate symptoms. Approximately 10 to 15% cases progress to severe one, out of which 5% roughly becomes critically ill, and they land up in intensive care units for further management. Typically, people who recover from COVID-19 after 2 to 6 weeks, they may suffer with lingering of symptoms. These symptoms could be anything progressing from headache to muscle ache to any symptoms that can further be prolonged up to 6 weeks or more. While most people with COVID-19 recover and return to normal health, some people may have got these symptoms which is further lingering. This persistent state of ill health is known as post-COVID condition. So, even people who are not hospitalized and who have mild illness can experience persistent and late symptoms. Some patients develop medical complications that may have lasting health effects. So now, what are the symptoms which we can consider as post-COVID symptoms made up of? These symptoms, the most common are basically fatigue, the brain fog. Brain fog means the fogging of the ideas, decreased stamina, hair loss, headache, chest pain, which is generally non-specific, presenting on any part of the chest, muscle pain, and sensation of pins and needles, which is very common in post-COVID syndrome, forgetfulness, depression, persistent cough, shortness of breath, palpitation, abdominal pain, and recurrent mild fever, in which the treatment is as such not required, but patient is basically annoyed because of the mild to moderate fever. Now, how this post-COVID syndrome affects our body? In more serious and long-term complication, it basically affects our vital organs like heart, kidneys, lungs, skin, and brain. And the presentation could be different, like inflammation of the heart muscle. It may lead to cardiovascular involvement. Lungs function abnormality may further deteriorate because of the lung involvement. Skin generally it presents as rash. Loss of taste and smell, very common symptom while COVID. It may further go on as it is in post-COVID syndrome involving the neural nerve cells, and further the psychological presentations like depression, anxiety, lack of mood stability. Now, who all are the patients who are more prone for post-COVID syndrome? These are basically people who are aged, that is older people, people who are obese, excessive weight, people who have got chronic conditions like diabetes, COPDs, that is the lungs involvement, CKDs like chronic kidney disease, and patients who are basically already on immunosuppressants for other diseases like carcinomas. There are multiple symptoms of presentation for same post-COVID syndrome. Now, I have selected the most important and the most common and the most annoying symptoms of all the post-COVID symptoms, that is the fatigue. The profound and prolonged nature of fatigue in some post-acute COVID-19 patients share features with chronic fatigue syndrome described after serious infection of COVID-19. Patient resources on fatigue management and guidance for clinicians on return to exercise and graded return to performance for athletes especially in COVID-19 is currently based all on indirect evidences, though because the research is still going on. Now, for fatigue management, basically, how do we approach? We approach for energy management, which is the basic pillar and the most important pillar for post-COVID syndrome management, fatigue. 3P, we follow the 3P plan, that is the plan, priorities, and the pace. That means first we plan, then we prioritize our needs, and then we how fast it should be implemented. Anxiety, for anxiety we reassure the patient, because a patient whose stamina is gone down, who is basically fatigued out, he or she may undergo anxiety very soon. So we have to reassure them that it is treatable. Routine gentle activity within self-assessed limitation physical activity advices. Rest and sleep, very important. Hydration, nutrition, and pain management. These are one few of the important treatment modalities for fatigue management in post-COVID syndrome. Now, how at Total Health we can help you to fight against COVID and post-COVID syndrome. Regarding COVID, now we have planned in 4-step manner. First is COVID information and prevention, in which as soon as the patient informs us that he is COVID infected via teleconsultation or with the physical consultation, we give him further information to stop the further spread of the disease and how he can prevent his family members and his near and dears to get infected from him. Second step is COVID treatment, which is done at Total Health by qualified physicians, and it can also be done with the teleconsultation if required. If the patient is already in quarantine, we used to prefer the teleconsultation mode, which is preferred mode for COVID management. Third is post-COVID guidance, which is very important, that I will further explain in my next few slides. And the last one is post-COVID care, which is very important thing for the management of post-COVID management. So first of all, regarding the protective measures, this is very, nowadays people are aware of this thing. Still, I am just revising it. Keep your distance, keep away from any suspected case of COVID-19, and the distance should be around 6 feet. Wash your hands frequently, if possible, with soap, or in place of that, we can use with 70% alcohol-based solutions. There is a definitive way of coughing in which you don't touch your hand, rather you just cover your nose and mouth with your elbow. Try to ventilate the room in which, if the patient is already in quarantine or there is suspected patient of COVID-19 is there, and wear a mask, very important. So these are the measures in which we can prevent infection from a confirmed COVID or strongly suspected case of COVID-19. So how How does COVID-19 rehabilitation program helps? So if the patient is infected with COVID-19 and recovered well out of the COVID-19, or he has got symptoms, he is coming out, he is PCR negative now for COVID. So in this rehabilitation program, we help him or her to avoid any kind of further lingering of symptoms related with post-COVID syndrome. So recovery from COVID-19 can be an incredibly anxious time for both you and your family, which is why we have developed a COVID-19 rehabilitation program. COVID-19 rehabilitation is a comprehensive program, basically planned and created by Total Health team, dedicated Total Health team for COVID management by qualified physicians and paramedics. In view of persistent effect of disease on the body, immediate addressal is always welcomed. Need of this program is more in COVID hospitalization survivals. It's clear that it's more required for the hospitalized patient, but it is also important to fight with post-COVID-19 syndrome in moderate to mild symptoms of the patient who has been managed while home care. It also helps in recovering majority of the patients with the milder forms. Plus, additionally, it informs a link between treating physician and the patients to identify limitations early. Just to note down here that this program we have created, this is not meant for those people who are presently infected with COVID-19 or who are under treatment. It is only meant for those people who have been recovered negative out of COVID-19, and there's a high chance that they may land up in post-COVID syndrome. So at Total Health, we are providing post-COVID recovery plan for faster and effective regaining of pre-COVID status. The services which we provide is definitely the physician consultation, the physical evaluation of different body parameters, including the vital stats, lungs evaluation including the pulmonary function test, 6-minute walk test, chest physiotherapy session, which is for evaluation and teaching the patient how to recover well from chest consequences of post-COVID, dietitian consultation, oral supportive measures, and most importantly, we have planned for energy booster infusions which are specifically directed towards fatigue syndromes related with post-COVID condition. Now, how this post-COVID package helps you for faster recovery? It improves your overall post-COVID physical and mental health, protect against progression of chronic diseases, aid in weight management, lower blood pressure and improve heart health, improve your quality of sleep, reduce feeling of anxiety and depression, combat fatigue and boost energy level or exercise tolerance, and improve your digestion. Overall, these are the common symptoms with which the patient of post-COVID syndrome is generally annoyed of. So we have targeted basically these symptoms, and we have targeted over this specifically to counter these kind of symptoms in post-COVID time. So we have divided in our plan the patients of post-COVID into two groups. So in scenario when we have kept those COVID patients who have been treated at home, that means they are mild or moderate symptoms. They have suffered from mild or moderate symptoms, but they have been treated at home without any complications. And in scenario 2, we have kept those patients who have been discharged from hospital after prior hospitalization for COVID treatment, because they are at the more risk. So this part of the package is more aggressive for them to avoid post-COVID syndrome. The details about this you can find on www.totalhealth.ky. Otherwise, you can call here at any time to know about these kind of packages. So this was regarding the post-COVID rehabilitation program, which we cover at the Total Health. But for post-COVID syndrome, one thing is clear, that the patients who has been hydrated well, rested well while the COVID treatment, the chances of landing in post-COVID syndrome has been found to be very less. Though there are still studies are going on regarding the post-COVID syndrome, there is no definitive guidelines for its management till now, but sooner or later we will get the guidelines how to manage about the post-COVID long-term treatment. So this was all about the post-COVID rehabilitation program at Total Health. Now I will request our viewers to ask few questions if they want to do so. And so, here I got first question from one of my viewers. Miss Kelly wants to know how common is the post-COVID syndrome overall. So Miss Kelly, regarding answer to your question is roughly around 10 to 30% of all COVID-19 cases has been observed to land up in post-COVID syndrome. Though this figure is not 100% true. Why? Because the studies are still going on. But we expect that 1 out of every 3 patients will be one day will be affected with post-COVID syndrome. Mr. Mark wants to know, is the post-COVID syndrome is permanent? So Mr. Mark, this is very difficult to tell that whether this post-COVID syndrome is permanent, because the studies are still going on, as I just told. But it's good news for our community that we have observed that most of the patients who are landing in post-COVID syndrome, after the rehabilitation, they have shown very good results. Not 100%, but the recovery rate is almost 9 out of 10. But they have to rehabilitate themselves or by a qualified practitioner. So Tracy wants to know, can something be done to prevent post-COVID syndrome? Yeah, Tracy, you are right. There are a lot of measures which can be done beforehand to avoid or minimize the post-COVID syndrome. The 3 most basic things which we can do is good hydration, good quality antioxidant full diet, and rest. These 3 are the basic things which we advise for all COVID patients to avoid post-COVID syndromes. So I will be happy to answer if any other viewer has got some question. Okay, so Mr. Alex has got one question. He wants to know, does it more common, I think he wants to ask that post-COVID syndrome is more common in hospital patients. Yes, Mr. Alex, you are right. Post-COVID syndrome is basically, it's common, not only common in hospitalized patients, but also the intensity and the syndrome-wise, the symptoms are more in hospitalized patients because their body has suffered more in case of while hospitalization. So now the next question is, Miss Amanda wants to ask, what recommendation you will give to a person that got COVID twice, not vaccinated, diabetic, high blood pressure, treated with ivermectin, recovered good without any complication? Okay, so regarding answer to Miss Amanda, the recommendations is, first of all, he should start his normal activities slowly. That means he should not jump on his pre-COVID status as such. It should be slow. For example, if he is a walker of 2 kilometers a day pre-COVID, he should start it with 100 meters on day 1. Then slowly he can increase slowly wise up to 2 kilometers pre-COVID. Second, hydration must be good. Third, any food item which contains antioxidants like all fruits, vegetables, etc. he can use in his normal diet. Plus he can have one good quality antioxidant. And still if he is not feeling okay, in that case I have prepared this post-COVID rehabilitation program which he can consider for his faster recovery. So Miss Heidi has got one question. Are all post-COVID patients with symptoms or asymptomatic likely with? No. I want to say there is though the exact figures are not yet available, but roughly in practice we have seen 1 out of 3, that is roughly around 10 to 30%, they land up in post-COVID syndrome. So Amanda again asked, what organ can be affected by getting COVID? So Amanda, COVID basically land up in a type of autoimmune reaction. The COVID virus induces autoimmune reaction and it can affect any organ. So if your brain is involved, your ideas will become foggy. If your heart is involved, there will be effect to the heart leading to raised blood pressure and tachycardia. If the kidney is involved, then definitely there will be change in the urine formation. So it can affect any organ till now, but there is no definitive study regarding the affected organ percentage. Till now it's not been proven yet, but sooner we will get studies regarding the same. But answer to your question is it can involve any organ till now. We have seen stroke post-COVID, we have seen heart attacks in post-COVID, we have seen obviously lungs problems is always there in post-COVID. We have seen skin involvement, including the rash and all, we have observed in post-COVID era. So one question I have got from Miss Walter, very interesting question. She have asked that Mr. Walter says, I got hit by COVID while my pregnancy, in 6th month of pregnancy, recovered well by 7th month of pregnancy, and her everything is fine. She has been evaluated well. Her pregnancy was normal. So she want to know whether her baby, which is born 3 months after the recovery, he is also at the risk of post-COVID syndrome. So Ms. Walter, the answer to your question is, till now there is no proven studies that says that if mother is affected, then baby will also become affected. But this is under our studies that we will, in future, we will study about this also, that the same disease, post-COVID syndrome, mother can also transmit to the kids. But till now, there is no such study. We haven't found any kid to post-COVID pregnancy affected female to be suffering from post-COVID syndrome or any specific change in his body after delivery. So if any of our viewers have a further question, they can ask. I am free to answer them. So one of our viewers want to know how much water is advised for hydration in post-COVID patients. So roughly in a normal person, we advise around, in a normal person of around 50 kg, we advise around 2 to 2.5 kilograms of water, or around 3 liters of water a day. But in case of COVID hydration, we expect 500 milliliters extra so that he can hydrate his muscles and the vital organs well, and the symptoms of post-COVID get decreased in them. So Heidi again asked one question: when a person is asymptomatic yet still testing positive with a low threshold around 24, what is the virus doing internally to the body? Okay, now this question is very interesting. So answer to your question, Heidi, is, as I said in the beginning, that not all COVID infections show symptoms. So there is a big chunk of COVID infections which are called asymptomatic infection. Now, to explain about this, when the virus get entry in our nostril and get reached up to the mucosa of the nose, because of in some person immunity or local inflammation, it crosses the mucosa and get into the bloodstream and infects him. But in some of the patients, it gets stopped there in the mucosa, and in the test they will become PCR positive. But since the virus hasn't crossed his mucosa in the nose and didn't reach to the blood, these patients won't show any kind of symptoms. Now, generally people ask, what is the advantage of vaccination? So this is the advantage of vaccination, that if you take a vaccination on time and if you complete the vaccination, the chances of symptoms are either decrease or they disappears. They don't come in patient even if they are infected with the COVID virus. Obviously, the complication rate is also less in case of fully vaccinated individuals. So I will be happy to answer if you get any other question from viewers. So with no more questions, I will stop my this talk here, and I will request if somebody has a question, they can put on our site or or on the Facebook handle, so that I can answer it later on accordingly. Thank you very much.